Hello, everyone. Thank you so much for joining me today for this webinar. My name is Dr. Sarv Varta Khalsa, and I am a naturopathic physician, and I have my practice here at Living Wellness Medical Center. And there are 4 naturopathic physicians here at our office, and we offer monthly webinars, which is a lot of fun. And this month, I decided that I'm going to talk about heartburn. One of the reasons I chose this topic is because it is so prevalent and common. And so, we all kind of know what heartburn is, but I thought I would go in maybe a little bit deeper to some of the details of what causes it, appropriate treatments, and things like that. So some of it might be review, and hopefully you'll learn a little something new as well. So let's jump right in. So what is heartburn? Heartburn occurs when the acid from your stomach regurgitates back up into the esophagus. So the cells and the lining in the stomach are designed to tolerate a very acidic environment. And this acid has a lot of benefits, which we'll talk about as I go through the webinar today. But the cells in the esophagus are not designed to tolerate an acidic environment. The lower 1/8 does okay of the esophagus, but once you get higher up than that, it starts hurting and causing symptoms. And so essentially, the acid that regurgitates into the esophagus causes symptoms. Typical symptoms are a burning sensation or pain or a pressure, either in the upper part of the abdomen, which is where the esophagus joins up with the stomach, or sometimes you'll have a sensation in your chest or in your throat, or all three. So it can be really variable from one person to the next, what the specific symptoms are. You can even have what we call silent heartburn, where you have no symptoms at all. You don't even know that it's occurring. And this is really actually the most dangerous form of it, because you don't have those symptoms to tip you off that this is occurring, but it's still causing a lot of damage. So people will maybe get an endoscopy. They'll see a gastroenterologist, get an endoscopy for some other reason, and then they'll see signs of it and discover that there's some inflammation or signs of GERD or heartburn going on. So it's a little trickier to treat these patients because we can't necessarily use symptoms as a way to determine if our treatments are helping. So we got to send them back to get another endoscopy to see if it is improving or it has resolved. Sometimes these symptoms of heartburn can be so intense that people feel like they're having a heart attack. That's very common for people to show up at the ER with chest pain, and they think it's their heart because it feels like it is, but it's really just heartburn. And so one of the first things that they'll do typically to rule out heartburn is they'll give you like a GI cocktail, something to drink that will kind of neutralize that acid, calm things down, and see if it helps. If not, of course, they'll do further testing to make sure that it's not your heart. So basically, anatomically, at the bottom of your esophagus is something called the lower esophageal sphincter. And this sphincter will open up as a reflex when you swallow food, and it allows that food to travel down from the esophagus into the stomach normally. And then it closes, and it prevents that closure, then prevents the acid from regurgitating back into the esophagus. What can happen though sometimes is that this lower esophageal sphincter is not functioning properly. It might be being stretched for different reasons, like a hiatal hernia or being overweight, those sorts of things. There are also specific foods and things that I'll get into in just a minute that will relax this lower esophageal sphincter, allowing that acid to come back up into the esophagus, and then you get symptoms. So another name for heartburn is GERD. You've probably heard that term. Gastroesophageal reflux disease is what that stands for. They're interchangeable terms. And you can have GERD with or without esophagitis, which is inflammation in the esophagus. And that's determined with an endoscopy typically. So about 20 to 30% of adult Americans experience acid reflux symptoms every week. And so it's very prevalent, very common. Part of it, of course, is diet. We call it the SAD diet, standard American diet. Not very good in some cases, in a lot of cases. And so, of course, there's so much more information these days about the importance of diet, and so many people are making efforts to change their diet. And so, perhaps it's become less common than it used to be as we learn more about it. But diet is a huge factor when it comes to heartburn. So, and it's very common. So what are the symptoms of heartburn typically? So you can have, as I mentioned, a burning pain in the throat or chest, which often occurs after eating or very commonly occurs at night, partly because you're laying down and you don't have that typical sort of gravitational pull. Basically when you're laying horizontal, that adds so much easier for that acid to go back up into the esophagus as opposed to when you're upright. You can experience a bitter or acidic taste in your mouth, and that's kind of the acid that you're tasting. You can have a chronic dry cough or a hoarse voice, and this happens because of the acidic irritation in the throat. And sometimes this is the only symptom that people have. So if I have a patient that comes in that has a chronic dry cough or has chronic hoarseness of their voice, this is always something that I think about and evaluate for them. The other thing that can happen sometimes is difficulty swallowing. And so after a period of time, if you've had heartburn and it hasn't been treated, you can certainly experience pain, kind of chronic pain around that, but also stricture of the esophagus. And it basically, an area of the esophagus can get kind of tight, and it's difficult to swallow your food or swallow supplements or pills and things like that. This can occur for other reasons as well. It's not always due to heartburn, but it can occur because of heartburn. And one of the things that they will do, if they're suspecting a stricture or they do an endoscopy and they see that you have a stricture, is they'll actually go into the esophagus and stretch it. They'll kind of try to stretch out that area that's become constricted. And that a lot of times will help. Not always, but most of the time it does help. Of course, you have to address the underlying reason why it's happening as well, things like heartburn. So what are the risk factors for heartburn? Older age, especially greater than 50 years old. As we get older, things start to change in our bodies and our digestive systems, and especially you can start to have a decrease in the production of stomach acid. Now that sounds kind of counterintuitive. It's like, wait a minute, I thought heartburn was caused by too much acid. And actually, it really is not. That is a misconception. In the conventional medical world, that's still how they view it, and that's how they treat it. But we know, and we'll go into other reasons why you can have heartburn, and actually a decrease in acid is one of the reasons why you can start to develop heartburn. And so it's not necessarily not enough acid, it's inappropriate release of that acid and, having that acid go places where it shouldn't be. Males are at higher risk compared to females. Chronic use of NSAIDs, pain meds, definitely are a risk factor. They can really, cause all kinds of digestive issues, stomach inflammation, heartburn, things like that. So that's a big risk factor. Smoking is also a big risk for developing GERD or heartburn. High body mass index or BMI and obesity, just having extra weight on your body and extra weight in the abdominal area that can then, put extra pressure on that lower esophageal sphincter. Remember, we have fat, in our entire body, but we also have, internal fat that you can't necessarily see. It's all like around your organs and things like that. And even, that extra pressure inside of the abdominal cavity can put extra pressure on the LES and cause heartburn. So losing weight is definitely, can be for some people, the solution for their heartburn. And of course, along with that usually comes dietary changes too. Family history. It can run in the family, kind of this tendency, especially if there's any kind of weakness of the lower esophageal sphincter or that sort of thing, or a tendency for the next thing, bullet point is a hiatal hernia. So what is a hiatal hernia? Essentially, so you have your esophagus that goes down into your stomach, and right at the top, right above your stomach, kind of between your stomach and your esophagus, is your diaphragm. And there's a small hole that allows your esophagus to kind of go through, and where it attaches to the stomach. What can happen sometimes is that the muscles around that area get kind of lax and weak, and the stomach actually starts to protrude above the diaphragm. And when it pushes up like that, it stretches that lower esophageal sphincter and it becomes weak. And so that can cause heartburn. Once again, these cases of heartburn are more difficult to treat often. I mean, you can treat them symptomatically and help to kind of decrease acid and therefore decrease damage. But sometimes, the hiatal hernia needs to be addressed, repaired if it's significant enough, or just know that in these people that have a hiatal hernia, they're just going to have more risk for that regurgitation of acid. And so maybe even long term, they need to take measures to ensure that there's not damage occurring. And you can diagnose a hiatal hernia once again with an endoscopy or endoscope, and that is done through a gastroenterologist. So what are the common triggers of heartburn? Diet, of course, is a big one. So fatty foods, spicy foods, coffee, black tea, really caffeinated beverages in general, chocolate, alcohol is a big one. Tomato sauce, because it's acidic in and of itself, and it can trigger heartburn for a lot of people. Citrus, once again, acidic, sodas, carbonated beverages, and peppermint. Anything in the mint family. It's interesting because mint and peppermint is actually a great digestive aid. It helps with digestion in general, but it can actually worsen heartburn. And so that's something just to be aware of. If you do have specifically heartburn, you might want to watch the peppermint. I would say it doesn't aggravate in all cases, but it can. Stress is another big one. That's a big risk factor for developing heartburn. When you're in that stress, kind of sympathetic stress mode, it's the opposite of the parasympathetic rest and digest mode. And so your digestive system is not going to be functioning as well if you have stress. Also, eating too quickly, or once again, inadequate digestion. Contents sit around in your stomach longer than they should. It's not fully digested because you haven't chewed well, you're eating too quickly, there's stress involved perhaps, and food sits around in your stomach too long, and then it will start to sometimes regurgitate for that reason. Eating too late, of course, too close to bedtime when you're going to be laying down, you should try to not eat at least 2 hours before bed. In most cases, just for everybody, that's the general rule, but especially with people that have heartburn. Smoking, once again, is a trigger. Obesity and certain medications can also trigger heartburn. So antibiotics, pain medications like ibuprofen and aspirin, certain blood pressure medications, some of the calcium channel blockers and the beta blockers especially can be triggers for heartburn. So that's also something always to look at. How's your diet? What medications are you taking? What are the risk factors? What's your family history? So what are the potential complications of heartburn or GERD, especially if it's left untreated? That's not good. And unfortunately, people do go long periods without addressing it or consulting a doctor. They just sort of think it's normal. Oh, I have heartburn. Doesn't everyone? No, not everyone does. And so, some people ignore it, or they're just not treating it appropriately. And so one of the potential complications is that you develop esophagitis, which is inflammation. Itis means inflammation in the esophagus. And that can, of course, cause discomfort, pain, and things like that. And sometimes in severe cases, actually lead to ulcerations and bleeding. The other thing that you are at risk for, which is pretty serious, is Barrett's esophagus. And this is a condition where there is a change in the cells, the type of cells that are in the esophagus. And they basically become precancerous. It's a precancerous condition. And it can eventually lead to esophageal cancer, which, of course, is not fun at all to get esophageal cancer. And so, that's something that if you are diagnosed with Barrett's esophagus, it requires very regular checkups and updates and endoscopies to evaluate those cells to ensure that they're not progressing any further. And, with good naturopathic treatments and changing your diet and things like that, this is potentially a reversible condition as well. And so, but it does need to be taken a little more seriously than just run-of-the-mill heartburn. And then the last thing that people are at risk for potentially is gastric or stomach cancer. So it's important to pay attention to symptoms of heartburn and treat them, seek treatment. So how is heartburn treated with conventional medicine? There are basically 4 different types of medicine that can be used. Antacids are probably the most common. Those are over the counter. You can get them anywhere. Things like Tums, Alka-Seltzer, milk of magnesia, Pepto-Bismol. These are all things that essentially just neutralize that stomach acid. It creates kind of like a buffer. And it can help symptomatically just to decrease that acidic feeling in the acid. Another category of medications is something called H2 blockers. And these are histamine antagonists. So they're not just neutralizing the acid, they're actually binding to these histamine receptors and blocking the activity. So these are, once again, over-the-counter medications like Pepcid AC, Tagamet, Zantac, ranitidine, which was actually removed from the market in 2020 because it was found that it contained a cancer-causing agent. Not good. It's always a little bit concerning when medications have been on the market 20, 30, 50 years, a long, long time, and all of a sudden, oops, causes cancer, sorry. But anyway, that's what happened with that one. Another category of medication is proton pump inhibitors, or PPIs. And these are basically blocking the production of the acid. So it's not just neutralizing, it's actually affecting the cells in the stomach that would normally produce the acid, and it's blocking the acid from being produced altogether. So this is the strongest form of medication. It is currently, a lot of these medications are over the counter at lower doses, things like Prilosec, Prevacid, Nexium, the purple pill, they call it, right? Protonix, Acifex. So these are over the counter, but you can also get a prescription for higher dosages if indicated from your doctor. And they tend to be more effective than the H2 blockers at treating esophagitis. So if you've actually been diagnosed with that via an endoscope with your gastroenterologist, they would most likely put you on an H2 blocker. They wouldn't really think that the proton pump inhibitor, and they wouldn't consider the H2 blocker to be strong enough. Sometimes they actually will put people on both. So, and that's just, once again, just a slightly stronger treatment. Of course, we'll talk about the potential side effects of doing all that, but they do work. They can be very effective. The last category are motility agents. These are not as commonly used at all, but what they do is they help move stomach contents through faster to prevent acid from regurgitating back into the esophagus. And this would be like a medication called Reglan. So what are the side effects of heartburn medications? Like I said, they do work really well, but what's the trade-off? What are you giving up? What are the potential side effects? So the kind of most common side effects that can occur, though I'd say most people tolerate these medications fairly well, just on the surface. But some potential side effects with the H2 blockers can be headache, abdominal pain, diarrhea, nausea, gas, sore throat, runny nose, dizziness. The proton pump inhibitors, kind of similar: headache, diarrhea, abdominal pain, bloating, constipation, nausea, and gas. I mean, a lot of these, as you can see, are gastrointestinal symptoms. And so you're kind of messing up, you're affecting the digestive system in a negative way. Even though you're treating the heartburn, you're affecting the rest of the digestive system in a negative way. Side effects of Reglan can be serious and may include drowsiness, fatigue, diarrhea, restlessness, movement problems, probably why this medication is not used as frequently. And just generally, I just wanted to mention the side effect of blocking the stomach acid, because the stomach acid is very important for digesting your food, breaking down the food that you've eaten, and starting that digestive process. It is also very important for nutrient absorption. And so when you don't have the acid to absorb these nutrients, it can lead to nutrient deficiencies. And then there's also less protection against viruses and bacteria and things like that, because it's sort of like one of your body's first line defenses. Anything that goes down through your mouth into your stomach will get killed by that acid. But if that acid isn't there, you're more vulnerable to certain infections. And so specifically, let's talk about the absorption issues of specific nutrients. The ones that are most typical, most affected, are vitamin B12. You need that acid for vitamin B12 to be absorbed lower down in the first part of the small intestine. Folate, magnesium, calcium, iron, vitamin C, and vitamin D. These are all nutrients that can become deficient when you're taking these medications, and especially, of course, long term. That's when it's really a problem. You have also, once again, the less acid protection, and so specifically conditions like C. difficile, C. diff, which is a specific type of bacteria that can overgrow in the large intestine, and it actually can be a pretty serious condition if left untreated, and it can be tough to treat. A lot of times C. diff can also occur after antibiotic use, but it can also occur from long-term use of these acid blockers. Also, H. pylori. It's kind of interesting because H. pylori is associated with gastric ulcers and things like that. Sort of, you kind of think chicken or the egg, which came first? Is the H. pylori causing damage, or is it the damage that's allowing H. pylori to sort of take hold in that particular area? And they have done studies to show that low acid environment puts you more at risk for developing H. pylori. So that's something that can be tested for, typically a breath test. There are a few different ways to test it, but I think the breath is the preferred method typically. And if it does come back positive, that can be treated. So, and then the last thing, potential side effect is gastric cancer. And that is a side effect not just of untreated heartburn or GERD, but also using these medications. So either way, fortunately, there are other ways to treat heartburn, which we'll talk about. But these, so there's basically an 8-fold increase after 3 years of PPI medication use. That's what studies have shown. And so that's not a good thing. And unfortunately, people do take these medications long-term sometimes. And so anytime I have a patient that comes in on these medications, especially the PPIs, the proton pump inhibitors, I make every effort to get them off of those medications. So how long should heartburn medications be used? Typically, it's recommended for anywhere from 2 to 8 weeks. If you buy something over the counter, it usually will say it's safe to take this for 2 weeks. And if you're still having symptoms at that point, you should consult a doctor. If you are seeing a doctor or a gastroenterologist or someone like that, then they will often recommend 8 weeks or so to treat heartburn. And, sometimes it can be effectively treated if there's, some acute reason maybe why they're having heartburn. Of course, in the meantime, hopefully you're also addressing other things like diet. But the 8 weeks is sort of enough time to kind of calm down the acid, heal any inflammation that has occurred, which you're going to be, of course, much more successful at healing that with naturopathic medical tools. And we'll talk about those. But 8 weeks is generally what's recommended. However, as I mentioned, unfortunately, a lot of times people get put on these medications and just never taken off, whether it's their doctor that keeps them on them because, hey, it's working, or it's the patient themselves that just, don't go back to the doctor and they just continue taking these meds for years, thinking that they have to. So over the counter, as I mentioned, 2 weeks, and then 8 weeks if you see a doctor, and then but people take them longer. So how do I get off heartburn medications? That's a good question. So antacids and the H2 blockers, the ones that are over the counter, typically can be stopped abruptly, but if whatever was triggering your heartburn to begin with has not been corrected, then probably your symptoms are going to come back. And so, that depends. Sometimes you can have short-term heartburn or GERD and then it goes away. But a lot of times symptoms will come back. For PPIs, the proton pump inhibitors, they need to be slowly weaned down. I cannot emphasize this enough. It is really important. And the reason is because it's very common to have something called rebound heartburn if you stop these medications abruptly, especially if you're taking a higher dose, maybe 40 milligrams or 80 milligrams of something. It will, when you stop it, you'll get heartburn that is even worse than your initial symptoms. It'll just be terrible. And of course, your immediate reaction is, oh my God, I have to get back on the medication. I'm feeling terrible. I'm suffering. And so if I have a patient that is experiencing this, obviously we haven't talked about it. Maybe they came in and they were doing it on their own or whatever the situation is. I will typically have them go back on it because it's just so uncomfortable. And then we'll work on slowly weaning it down, and we'll kind of come up with a very detailed plan on how to do that. Usually it's just, a gradual progressive decrease in the dose over a period of time. And usually I'll do it weekly. So let's say you're taking 40 milligrams of a medication. I'll prescribe a 20 milligram dose, and then we'll alternate every other day, 20 milligrams, 40 milligrams. And then the next week, maybe you're down to 20 milligrams, and then 10, alternate, and then 5. So it's a gradual, decrease over at least a month period of time. And usually if you do it that way, it's much better tolerated. And of course, in the meantime, in that process of weaning down, you're providing other tools. You're working on improving diet, avoiding any triggers, and using natural treatments that can help treat heartburn as well. So that's what we're going to talk about next. Are there natural treatments that can help with heartburn? Yes, of course, and thank goodness. So diet is huge and has to be the foundation, especially if you don't have a good diet. And so you want to, of course, avoid triggers. That whole list that I talked about, those are kind of common triggers. And you can also have individual triggers. Maybe you have a food sensitivity or something like that. It can be even a healthy food, maybe bananas or whatever, or apples, whatever it is. It can trigger heartburn if your body is not reacting well to that food because it's developed a sensitivity. And by the way, you can test for food sensitivities. It's a blood test. We test for IgG antibodies showing an immune response to basically all the different foods are tested. About 96 different foods. We have a 184 food panel as well. That's super comprehensive. So that sometimes will be something that I recommend in a patient that has chronic heartburn, especially if they're doing all the right things and still having symptoms. That's something that we'll explore. So you want to avoid triggers, plenty of fiber. That's really important. A well-balanced whole foods diet, lots of fruits and vegetables and all that good stuff. And then specific natural treatments. So DGL is probably my favorite for treating heartburn. DGL stands for deglycerinated. Say that 5 times fast. Chewable tablets. And so DGL, that's why we call it DGL, because it's a lot easier to say. So DGL is very effective at both symptomatic relief of heartburn. It kind of soothes everything, but it also is very healing. So if you have inflammation in your esophagus or in your stomach, DGL is soothing as well as healing for the cells and the mucosal lining in your digestive system. So I recommend that commonly, very often. Another thing I might recommend is a GI repair powder. And so a lot of times there's so many different options with these powder mixtures, but they'll have often DGL, some aloe vera, slippery elm, glutamine, which are all, once again, soothing and healing for the digestive system. And glutamine specifically is the main fuel source for the cells in the lining of the digestive tract. And so that can be really restorative. And it also helps decrease inflammation. Sometimes I'll recommend liquid calcium and magnesium if I have a patient that's really struggling with the symptoms of heartburn, especially heartburn at night. It's kind of like doing a Tums in terms of neutralizing that acid, but it's a much cleaner way to do it. Tums has binders and fillers and colorings and, stuff that your body does not need. And so I'll recommend a liquid calcium magnesium that's really clean and pure. And it just helps to neutralize the stomach acid. I'll often recommend it either symptomatically for symptomatic relief during the day or at night if they have nighttime heartburn. Take a tablespoon before bed. And a lot of times that will help to decrease that heartburn and symptoms at night. It also, because of the magnesium, can help regulate your bowels because magnesium helps stimulate your bowels and you can have a nice bowel movement in the morning doing the liquid CalMag before bed. Baking soda. So this, once again, is symptomatic relief. It's not curing anything, but it's at least symptomatic relief and it neutralizes the acid. And typical dose is a teaspoon in a cup of water or half a teaspoon in half a cup of water. So that can be used for relief. Apple cider vinegar. So the dose would be a tablespoon in a cup of water before meals. Sometimes this can be a little tricky in people that are having active acute heartburn because, vinegar obviously is acidic. And in the initial phases of treatment, it might be a little too strong. We might want to focus on soothing, healing, changing diet, and then introducing the apple cider vinegar once things are a little more calmed down and neutral, and not so flared up. But the apple cider vinegar does help to provide more acid to the stomach, which helps with digestion and all the good things that it does. And then it's also alkalinizing for your body. So it has so many health benefits, apple cider vinegar. Also, you can elevate your upper body during rest or sleep. This is really important. And it can be really helpful for people that, especially, of course, have nighttime heartburn. Also, it's really important to chew your food very well. That starts the process of, breaking down the food and getting it ready for that digestive process. And then eating in a relaxed environment. Once again, if you're in that sympathetic stress mode, you're not going to be digesting your food as well, and your chances of developing heartburn definitely increase. What are the dietary recommendations for heartburn? Lots of fiber, as I mentioned, whole grains, fruits, vegetables, oatmeal, flax, and chia seeds. Alkaline foods like fruits and vegetables, bananas, melons, cauliflower. Foods that contain a lot of water, just to kind of water down that acid a little bit. Celery and cucumbers and watermelon and lettuce. And then, of course, definitely minimize fatty foods, decrease carbohydrates and increase protein, and avoid common triggers. So how can you prevent heartburn for good? Permanently avoid any obvious triggers, of course. Eat a healthy diet, like what I just talked about, the heartburn or GERD diet. The Mediterranean diet, they've done a lot of studies actually to show that the Mediterranean diet can be really helpful at preventing heartburn. And that's basically a plant and whole food-based diet that focuses on lots of fruits and vegetables and whole grains, nuts, and moderate consumption of seafood and poultry, and low consumption or none of red meat. It's also recommended to eat 5 to 6 small meals per day rather than 3 larger ones. That just kind of lessens the burden a little bit on your stomach and your whole digestive system. And so you can develop less heartburn because you're doing that. So in conclusion, heartburn is common. However, fortunately, it's treatable without medication in most cases. Sometimes I'll use both. Sometimes very often I'm getting people off of those medications if possible. But yes, it's very treatable, and most often with natural therapies. And dietary changes, of course, are key for long-term prevention of heartburn. All right, so that is my presentation for today. Hopefully you learned a little something that you didn't know before. If nothing else, hopefully it was a good review. We will be sending out an informational handout on heartburn for the people that signed up for this presentation, so you can expect to receive that. Also, if you know someone that wasn't able to attend this webinar and you think that they could benefit from it, it will be available on our website. Usually takes a couple weeks for it to be posted on our website, but that is available later. And then also, of course, all of the doctors here at Living Wellness Medical Center are happy to see you if you're not already a current patient and you're interested in becoming one. We all offer a free 10-minute kind of meet and greet, a phone conversation where we can discuss what your concerns are and make sure that it's a good fit. So at this point, if anybody has any questions, I would be happy to answer them. And I'm going to switch over to the chat here. So Pat is asking, can you address LPR? LPR. I'm sorry, I'm not sure what LPR is. If you could just type up the long version of what that acronym means. And then, Beth asked, can we get this video for sharing with family? Hopefully I just answered that question. Yes, it will be available on our website. The best way to find it, you can either go to the front page of our website and go to blogs, and it's usually listed as most recent to older blogs. Oh, wait a minute. No, that's blogs. But you can go to, I think we have a webinar section. And then also you can go to, at the bottom of our front page on our website, there's a search button, the search engine, and you can just type in whatever you're searching for. You could type in heartburn and this webinar will come up. And so you can access it that way. And hi, Sue. Sue's saying hello. Hi. And also asking, is drinking alkaline water helpful or harmful for acid reflux? Yeah, that's a good question. I would generally consider alkaline water to be helpful. I don't think that it neutralizes your stomach acid in the same way that some of these other things would, where it would affect digestion or anything like that. And certainly, I suppose symptomatically it might help a little bit the same way, that eating an alkaline diet and things like that would help as well. So I would say more helpful than harmful. I do really like alkaline water. I think it's a good idea. Any other questions? All right. I don't see any other questions coming through. So, and hopefully, oh, and Pat, if you can hear me, feel free to type in a little more of what you mean by LPR. I'm sorry, I don't know what that means exactly. I'm trying to think. LPR. Anyway, you can also, feel free to reach out to us, through our front office if you have specific questions that haven't been answered during this presentation. I'd be happy to answer any questions later. Oh, okay. Oh, larynx reflux. Like in the larynx? I'm not sure about that. Sorry, Pat. I'm not sure if I can comment on that. Except perhaps I'm not sure if maybe there's damage to the larynx because of acid regurg. And so when you have acid come up into the throat, you don't only have your esophagus, right? You've got your larynx and your voice box and your vocal cords and all of that. That's why hoarse voice can occur and a cough and things like that. So I don't know if maybe that's what you're referring to, but that can be, an effect from having chronic heartburn as well, kind of irritation and damage to that area. So hopefully I sort of answered your question. I'm not sure. All right. So I think that's all the questions for today. Once again, I want to thank you for joining me today for this webinar, and tune in next month for our next one. And I hope everyone has a wonderful weekend. All right. Thanks. Bye-bye.